We're learning more about the MRSA cases at Children's Hospital of Pittsburgh. This afternoon, an infectious disease specialist from the Allegheny County Health Department explained what MRSA is and how it spreads. John Shumway's live tonight with an update. John.
Yeah, and we also heard from the hospital today as well. And the medical experts are telling us that all the babies who arrive at the NICU are tested for MRSA. So it's not unusual to find some cases of it. A lot of times, the babies actually catch it from family members when they are born. Now, while they're hesitant to call this an outbreak, certainly the number of cases above the norm meets the criteria. Concerns were first raised and testing in the NICU done last Thursday. And by Friday, the hospital knew it had an issue and notified the health department.
We have 6 confirmed positive MRSA cases in our NICU. All of the babies are stable, and none of those babies are demonstrating signs or symptoms of any type of infection.
One baby is being treated as a precaution.
MRSA is treatable. It is resistant to methicillin, penicillin, basically the cillin. So there's a class of antibiotics that it's resistant to, but there are still several antibiotics that can treat it.
Treatable even for the fragile patients in neonatal intensive care. So there are heightened precautions.
Low birth weight babies, babies in a NICU are more susceptible to both colonization and infection. And that's why hospitals take a lot of precautions.
When the hospital asked staff to come forward if they had a possible issue, they did, and 6 tested positive.
We have put them off work until we have been able to demonstrate they have a negative culture.
Meanwhile, gowning and precautions are being taken for everyone in the neonatal intensive care unit.
We have also limited visitation as an extra precaution for these babies that are in contact isolation, so that the visitors are only the parents or the guardians at this time.
As for a possible source?
At this time, we believe that the source is potentially a visitor.
Yeah, Nurse Harp says that they have identified that visitor, not a family member, but a visitor to the NICU, but she declined to give any other details about that person. Dr. Mertz also says it is not possible at this point to give a timeline of when Children's is going to be in the clear. At Children's Hospital, John Shumway, KDKA News.